Good day, class. This is Dr. Brace, and this is a quick lecture video on Chapter 8 in the text, focusing on interventions, and I'm going to focus specifically on health education programming. So, in the era of public health, we want to focus on collaboration when we are creating an intervention. We want to make sure that we're engaging those who are part of the community. Partnering is key. We want to make sure that our partners or our stakeholders are at the table when we're making decisions about what we're going to do and why we're going to do it, especially those who would be receiving the program, to make sure that they even think there's a need for it, or if we're creating something in a manner that may not be culturally competent for what they would expect. So partnering is key, collaboration is key. Public health works with people across multiple agencies, types of jobs. So that's something you want to keep in mind when you're thinking about what you're going to plan. When you are planning a program, there are different tools that you can use, and a logic model is one of those. There's an image of one on the next slide. A logic model is a visual way for you to communicate with your partners and show what you're doing. So what are the resources you have? What are the activities you're going to do? What are your short, your intermediate, and your long-term outcomes? And this can show individuals who may not be public health focused, okay, this is what we need, this is what we're going to do, and this is how we're going to do it. Logic models, there are so many templates out there that can be used to make a logic model, so they can look various ways, but they're all going to have the same basic components. So they'll have their inputs, activities that are going to be created, outputs, and outcomes. Generally, this is a one-pager that someone can look at and give it a quick once over and have a decent understanding of what you're planning to do. So this is just a very basic logic model. This is from figure 8.1 in your text, and it shows you evaluation along with the program. So at the top in the orange, those are your evaluation components. Process evaluation is looking at your program and whether or not the program was delivered in the way it was intended. And your outcome evaluation is looking at, was your program effective? We're going to talk more about evaluation in Module 8, but just know that that is part of a logic model, which is part of the planning. And you want to make sure that when you're figuring out what your program will be, you're also trying to figure out how you're going to evaluate and determine if your program was effective. So other components of your logic model are your inputs. So what do you need to make this program happen? Is it staff? Is it funding? Is it a location? You then are going to have activities. So what are you going to do that's potentially going to change someone's behavior? Your outputs are the things that you might be working with your curriculum, what people are created from the lessons, things like that. And then you have your results. So you might have short-term results that are you trying to increase someone's knowledge related to nutrition. So what is more healthful food? What are foods that we should eat in moderation? Changing their knowledge about that can lead to midterm outcomes, which are a little further down the line. And these are things where they're actually implementing and eating those healthier foods and eating less of the less healthier foods. Long-term outcomes are generally going to be the changes in a health status. So if your goal is to reduce obesity rates, which is a really complicated thing to do, but those would be long-term outcomes that you would be measuring. And they're often the measures that are most difficult to get, because following your participants in your program over a long period of time doesn't always work out so well. So this is a very, very basic logic model. You would describe in each one of these components, what are you doing? What are your inputs? What are your activities? What are your outputs? And then your outcomes. So it wouldn't look just like this. You would have a description of everything that goes in each one of these boxes. And again, it would be a one-pager so that you, your coworkers, your community partners, your stakeholders, they could all look at it and be like, yep, I see what you're doing. Thanks. So moving into creating a health promotion intervention, there's no best way of doing an intervention. You do want to make sure you plan well. Well-planned interventions are more likely to be successful interventions. And when you're planning them, you want to look at risk factors. You want to make sure your intervention is theory-driven. That way you can make a connection between what your activity is and what your outcome is. You can explain what happened. You want to make sure that your intervention is based on the best possible evidence, so using reputable sources. You also want to make sure they're ethical. You don't want to cause harm, and you don't want to intentionally omit groups that could potentially need your program. You want to tailor your intervention to be appropriate for the culture who would be getting your intervention. You want to follow professional standards. You want to make sure that you're efficient. You evaluate your program, and you have the evaluation included from day one. So you're thinking that from the beginning. And you want to support a community initiative. And you can either adopt an existing intervention, say there's an intervention out there that doesn't quite fit what you need, you can adapt it to meet your needs. Or if there isn't anything that'll work or anything that you can change, you can create something from scratch. So when you are thinking about your programs, you want to use design thinking, and this is your analytic and creative process that helps you understand what your community needs, what you can do to try to come up with solutions, and then you can come up with example or pilot interventions that could be used. And this process gets you the opportunity to get feedback multiple times, so it's an iterative process, so that you can update and improve that prototype or that pilot program. So there's 5 stages in design thinking, and the first one is empathize, and this is you seeking a deep understanding about health issues. That's going to allow you to understand what needs to be done, so you'll need to have good knowledge about whatever it is you're trying to change, and then also for you to realize the importance of it. You want to be able to define what are the priority health issues, so you don't necessarily want to focus on something that isn't really concerning, but instead you want to focus on what is most concerning. You want to think about and brainstorm different possible solutions. You want to build that prototype or build that solution, and then you want to pilot test it and improve it. So those are the 5 stages of design thinking. So if you have looked in the research, you've looked at best practices, and you've identified there are programs out there that exist, you can adopt a health promotion intervention. If you look at an intervention and it doesn't 100% fit your needs, but it's close, that's when you would adapt it. So in order to determine what you would do, make sure that, again, that is an evidence-based best practice, something that has been effective in the past. So you want to make sure there is sufficient evidence to show that the intervention is effective. You want to make sure that that program or intervention has been successful dealing with the problem you're working on. And has it been implemented with people similar to those in your priority population? And has that program already been adapted and been used in different settings? So one of the programs we looked at in week 1, and we'll revisit it, is the diabetes prevention program. And that is a program that started in a clinical setting, and then it moved into different community or different population settings. And that's a program that has good evidence that shows that it can be successful in clinical, it can be successful in religious settings, it can be successful in worksite settings, and so forth. So the DPP would be an example of, if your focus is on reducing the likelihood of someone developing diabetes, that could be something you look towards. But if it doesn't 100% fit what you need or want to do, it doesn't, you don't have the amount of time that the program initially as developed takes, you might adapt it. So it could be a starting point, and you could use it as is, you could adapt it. So when you are thinking about this, you want to also, if you're trying to adopt a program, do you have resources at hand where you're planning on doing this to make sure that you can accurately implement the program? And then you'll have to consider, how does this new environment that you would be using, how is it similar or different to where the program had been used previously? So if you're trying to go from a clinical setting to a religious environment, a church, or you're trying to go to a workplace, you'll have to consider those differences in settings when you're thinking about your program. So when you're looking at this program, and if there are things that don't quite work, you don't have 16 weeks to work on the DPP curriculum, you might need to adapt that curriculum so that it fits your 10-week time frame. If you are initially working with a program that had been made with written materials and you want to do it online, you'll have to look at adapting that to be offered in an online setting. So you've identified evidence that shows there is an intervention, you can use it, but it doesn't 100% fit your needs or setting, etc. You then look to see how you can adapt that curriculum so that it best works with the circumstances of your priority population. And the Centers for Disease Control and Prevention and some of their partners have created a framework that you can use when adapting an intervention. So when you are looking at adapting an intervention, and this is figure 8.3 in your text, you want to use this as a guide. There are 3 phases in adapting. There's the assessment phase, your preparation phase, and your implementation phase. You've got action steps that are listed. So is this a good fit for your population, for your stakeholders, your organization, and so forth? If you adopt it, then you don't have to, make significant changes. If you do need to make adaptations, this is where you would decide whether or not you're doing that. Once you've adopted or adapted, you would make those changes, you would pre-test it with your population, implement that program, and then make changes based on the pilot program, and then implement the final adaptation. You also will have feedback loops throughout, and then you'll have your program evaluation throughout, which will help you with making those adaptations for your program. So that's a brief description of the adaptation process from CDC. Definitely read through this in your textbook and think about whether or not you might adapt a curriculum for what you're going to do in this course, or whether or not you will adopt an existing curriculum and it can be used as is. That's all going to depend on your priority population, your resources, your stakeholders, your environment, and all of that. Thank you, and you all have a wonderful day. And if you have questions, post them to Blackboard, and I will answer them there.